Hi, I'm Stephanie Winfield with the Public Health Office of Practice Planning and Local Partnerships at the Colorado Department of Public Health and Environment. And can you please introduce yourself and tell us about your role and how long you've been in your position?
Of course. My name is Scott Bookman. I'm the Director of the Division of Disease Control and Public Health Response at CDPHE. And so my division is the State Lab, our Office of Emergency Preparedness and Response, and then all of our disease control functions, so our epidemiologists, our data teams, our immunization group, our equity team, and then all of the support services that go with a division of that size. I have been with the department since the spring of 2019. I actually started as the director of the State Public Health Lab, and then in early 2020, I became the state's COVID-19 incident commander.
Great, so you cover a lot of ground here at the department.
We've got a big division with a lot of responsibility in keeping Coloradans safe and healthy.
Tell me a little bit about what CDPHE's role is in an emergency.
Well, in an emergency, public health in general has a very large role. And CDPHE, as the state health department, has a very large role as well. And so there is something known as the National Incident Management System and the Federal Response Framework. And so within that framework at the federal level, they break the response out into 15 unique emergency support functions. And each of those emergency support functions aligns with the agencies that are responsible for coordinating the response efforts in those areas. And so ESF2 is communications. And we are ESF8, which is public health and medical. And so the responsibility for public health and medical is very, very broad. And it is responsibility that is shared both at the state and the local level, but it involves coordinating all of the public health and all of the medical responses to any type of incident, whether it is a bioterrorism incident, or a pandemic, or a wildfire.
And then can you tell us a little bit about CDPHE's role in the Marshall Fire response and maybe kind of an overview of the Marshall Fire?
Yeah, well, obviously the Marshall Fire was an incredibly unique response, the most destructive wildfire in state history, and a rapidly moving wildfire on top of that. And so we were notified early on that the Marshall Fire had begun, and we internally began our response coordination efforts, bringing together divisions from across the department, and additionally keeping our executive staff, our executive director in the loop at all times. And so our health facilities and EMS division has responsibility for ensuring that the facilities that they regulate, nursing homes, skilled nursing facilities, assisted living, that they are notified if they need to evacuate, and making sure that they understand where all of the patients have gone to if an evacuation occurs. Our air pollution control division is responsible for doing air alerts to make sure that the public understands where there is unhealthy air across our state. Our water division does an enormous amount of work in partnership with local water jurisdictions to make sure that drinking water is safe and available. And when those drinking systems aren't on board, making sure that the efforts are in place to get those water systems back on board, and that we have backup water, whether it's bottled water or big tanker trucks coming in. And then our hazardous materials division was responsible for evaluating the state of all of the debris after the acute phase of the Marshall Fire was over. And then, of course, we brought in our state toxicologist to make sure that there was good communication to the public about the risks associated with ash and debris. There were a lot of questions. Again, this fire was so unique in that it happened in this suburban urban core where there were so many residences and schools and people thinking about their kids going back to school and the impacts of all of that. And then, of course, the disease control work also began with that. We were in the middle of yet another COVID surge. And so we know that when you bring people together into, shelters, and when you're rapidly evacuating, you've got life safety issues. You got to get people out. But there are impacts of that, right? And so all of that work is work that we conducted, and then all of it in partnership with our local jurisdictions as well.
Right. So many different aspects of the department and so many different things to think about. And you've touched on this a little bit, but how similar or different was this fire from other emergency responses?
Well, the Marshall Fire was similar and it was different. It was both, right? It was different in the size. It was different in the speed of it. It was different in that it was in this, suburban urban corridor. And normally we see these things, the interface, right, of truly rural, and we just didn't have that here. I mean, this was in the heart of residential communities. We had, I think there were 40 residential care facilities that were all either in the evacuation or in the pre-evacuation zone, and so it was a really unique and different response based on that size and based on the populations that were impacted by it. But it was also very similar to the work that we have done for years, and certainly the work that we have done over the last 2.5 years, and at that point, about 2 years in our COVID response. COVID has forced public health to rethink how we do a lot of our work, to be really nimble and forward-leaning, and the Marshall Fire required us to use all of those new skills as well. And so we brought together our Outbreak Response Coordination Center. We made sure that we had testing available for COVID, for wastewater, for drinking water, to make sure that we were keeping the public safe and healthy immediately. Obviously, the lessons learned from COVID are enormous, and it really allowed us to lean forward and engage quickly, and to do this in partnership with our local public health. I had multiple conversations and text message threads going with the executive director of Boulder and Broomfield County Public Health.
You talked a little bit about how this took place within COVID and all the things already in place. So what else allowed CDPHE to be really nimble because of what had already occurred with COVID?
Well, as I said, COVID has forced us to rethink how we do everything in public health. It has given us opportunities to build new relationships. It has given us opportunities to build new structures. And so that COVID framework of our deep and connected partnerships with local public health on the ground every single day, constant communication around COVID, transitioned seamlessly into our response to the Marshall Fire. We have been doing an enormous amount of coordination and partnership with our healthcare systems, our hospitals, to make sure that they have been prepared and coordinated over the entire COVID response. And so, we found ourselves not only facing the evacuation of, several dozen long-term care facilities, but we also had one acute care hospital, a large hospital that needed to begin evacuation efforts, a second hospital that was preparing to do an evacuation. And so all of this just fits so seamlessly into the framework that we have created for our COVID response.
Yeah, so it sounds like those relationships and partnerships that you put in place during those 2 years really helped with this response.
Yeah, COVID has been very, very hard. COVID has taxed all of our systems enormously over the last 2.5 years. But we have also built incredible relationships, incredible systems and structures to allow us to respond. And COVID has been, a number of emergencies within the overall emergency. And so between outbreaks at long-term care facilities and, scaling testing and creating the infrastructure for building our mass vaccination campaign, we're used to really having multiple irons in the fire at once. And so, when the Marshall Fire happened, we were really able to embed it in our overall command structure and continue our response to COVID. Include the Marshall Fire, at first as its kind of own special response structure. And then, when the acute phase was over, we really just moved a lot of it back into our COVID response.
So how will the response to the Marshall Fire help us, help the state respond to the next emergency?
Well, I think the Marshall Fire was a unique test of these new systems that we have built over COVID. And over time, we have learned what worked in COVID and what didn't work, and we've tweaked things, and we've really had this broad and comprehensive public health response to COVID across our state. And so, what we didn't know for sure is whether that framework was going to be transferable to other types of emergencies. And the Marshall Fire proved our concept. It proved that these structures and these frameworks and these critical relationships would work in a devastating wildfire, just as they did in a pandemic.
Yeah, that's some good information from a hard situation to learn, right?
Yeah, absolutely.
So what would you say, what does an all-community approach to prevention and emergencies look like?
So what we know about responding to emergencies, particularly wildfires, floods, those type of environmental emergencies, we know that some people have more difficulty getting out safely than others. We know that there are people or facilities that may have communication challenges. We know that there are people who certainly have mobility challenges as well. And then there are people who are more vulnerable to the smoke that's associated with a fire like this. And so, continuing our emphasis on looking at long-term care facilities and making sure that they are always prepared to shelter in place or to evacuate, and that we have the plans in place needed to ensure that those who are most vulnerable in our communities can be rapidly moved, but moved in a safe manner.
Is there anything else that you want to share or tell us about this experience or prevention or what you're thinking about moving forward?
I would say that the single greatest learning of the last 2.5 years, and that's COVID, it's also the Marshall Fire, is the importance of relationships between the state and our local partners. This is shared responsibility. It is shared work. Our local partners obviously have the best information and the best understanding of what's happening on the ground. The state has some regulatory responsibilities, but also has that broader view statewide, has the ability to bring different resources to the table. And so, continuing these relationships, continuing these partnerships, and ensuring that the systems that we have built in COVID have pressure test in the Marshall Fire, that we continue doing this work as we go forward.
Great, thank you.
Thank you for having me.